Today on the Warrior Line Spotlight, we'll have an honest talk about PTSD with Dr. Sheila Rauch. Dr. Sheila Rauch is the Deputy Director of the Emory Healthcare Veterans Program, and Emory has partnered with the Warrior Alliance to support veterans and their families. Rauch is also the Director of the Mental Health Research at Atlanta VA Medical Center. So today, we'll find out what you can do to battle back against PTSD and what every American can do to support our great veterans as they cope with life after combat. For over 20 years, Dr. Rauch has been working to improve veteran access to effective mental health treatments. She's written hundreds of peer-reviewed articles and 6 books on the subject. Dr. Rauch focuses on treatment of anxiety disorders, psychosocial factors in medical settings, and the relation between physical health and anxiety. Dr. Rauch is an Army spouse, so she's one of our own and someone veterans can definitely trust. It's quite a privilege to welcome Dr. Rauch to the Warrior Line Studios today. Tug and I hope that our conversation will help veterans and their families find pathways to improved mental health. So let's get started with Dr. Sheila Rauch. Welcome to the Warrior Alliance Network.
Thank you. Thank you for having me today.
It's such an honor and a privilege to have someone who's working so closely in a field that I feel like is underfunded, under-researched, under everything. You know, and this is not just a veterans issue, although it's that too, but it seems like it is an American issue that we're struggling with right now when it comes to mental health. So what inspired you to devote your life to clinical psychology and serving people with mental health challenges?
Well, I actually, going back to when I was a child, I had a rare kind of leukemia as a kid and spent 3 years getting lots of chemotherapy and enrolled in clinical trials, and I'm still here, obviously. I had a very small percentage chance of survival, and after surviving that, I wanted to do something meaningful with my life. At first, I thought I would be a nurse, but I don't like blood, so that was a negative.
Understandable.
And so then I moved to psychology, and I love helping people. I love figuring out how to help people and how to make our treatments work better. So that's really how I got started at first. And then I moved into post-traumatic stress disorder in graduate school, really focusing in on how can we mitigate the impacts of exposure to trauma, because trauma is so ubiquitous in our culture. Like, most people in your life are going to experience at least one trauma, whether you're a veteran or not. And I married a veteran, and that kind of moved me into that space of working with veterans then in post-traumatic stress disorder. After 9/11, I was working at University of Pennsylvania in the Center for the Treatment and Study of Anxiety, which is a really big research group figuring out how to do treatments for anxiety disorders and PTSD. And after 9/11, I thought, I want to take what I know about how treatment works, and I want to bring it to the VA. And that's what I did. At that point in 2005, I took a job at the VA and really started working on research and programs and program development, trying to take care of our new veterans who were coming back, because I saw that as a way that I can serve the people that are serving us and keeping us safe.
Fantastic. Do you see some of that crossover? Like, I know you're kind of focused on veteran stuff. Do you see some of that crossing over into civilian life too, where this research that you're a part of helps everywhere?
Maybe
Right.
first responders too.
Yeah,
right?
that's right.
Yeah, and I do a lot of work outside of veterans as well, with first responders, with sexual assault survivors, with domestic violence survivors, and even the veteran population is very, it's a very mixed group. So there's lots of different kinds of exposures that veterans may have, even during their military service. There are very high rates of military sexual trauma, high rates of other types of traumas, even motor vehicle accidents while someone is in the military. And all of that really translates across to all of our U.S. population.
What led you to Emory and then ultimately the VA?
So I was at the VA first. So I actually left the University of Pennsylvania, took a job at the Ann Arbor VA and the University of Michigan, where I was for 10 years. Go Blue.
I was going to say, come on now. I saw you light up there.
So
National champions last year.
I was there for 10 years and really enjoyed the time there, really set up a bunch of programs for post-traumatic stress disorder at the VA. Got into research really looking at the mechanisms of change in PTSD treatment. So what's changing in the brain and in the body, and how can we make treatments work better, faster for more people? And that work really started when I was in Ann Arbor. And then a good friend of mine, Dr. Barbara Rothbaum, got funded for the Emory Healthcare Veterans Program from the Wounded Warrior Project to build this intensive outpatient program, straight from the ground up, a 2-week treatment program for the invisible wounds of war. And she recruited me down to Atlanta. I grew up in Atlanta, so it wasn't too hard of a recruitment. But I came down so that we could set up this program really from the ground up, from everything that we know, and really trying to make a program that works as quickly for as many people as possible. And it's open to people, veterans, post 9/11 veterans from all over the United States can come for 2 weeks. We treat all of the invisible wounds of war because it's not just PTSD that comes about after someone's experienced trauma. There's depression, there's substance abuse, traumatic brain injury. Those are all issues that we address with our 2-week program. They come, they stay in a hotel across the street, and we hammer out as much as we possibly can in that 2 weeks. People are getting over a year's worth of care, of therapy, and medical services and other services, and an interdisciplinary holistic program.
Wow. So fast forward to now, I mean, you set all that up, and now after a lot of publication and work and research, you're one of the most respected and revered experts, and you're widely published, like I think well over 200 peer-reviewed articles and 6 books. What can you tell our listeners, to make it simple to understand, what the cause, the symptoms, and the best practices are for healing when it comes to PTSD?
Yeah. So I like to describe PTSD as people go through, as I mentioned, most people in your life are going to experience a trauma. For some people, that trauma gets stuck. And it might be multiple experiences of trauma, or it might be a single experience of trauma, or it might be that you have lots of traumatic experiences, but one just kind of gets stuck and the others didn't. But what really makes it PTSD is that you're haunted by a memory or memories. And it's coming back to you again and again in nightmares and thoughts. It's like making you have emotional reactions and physical reactions when something in the environment reminds you of it. And that's really PTSD. We think what drives that, what really develops into PTSD, is caused by people who experience a trauma and then try to push that trauma out. They try to avoid it and not think about it. And what we find is, as the more that you try to avoid it, the more it just comes back, and again and again and again. And the less that you're able to see that if you approach that memory, that it might bring about some emotions or some strong reactions, but the more that you approach it, the less intense those emotions and reactions get, and the more that you'll feel in control of that memory compared to it controlling you.
What are the responsibilities that you have as the Deputy Director of Emory Healthcare's Veterans Program, and how does it work to address like PTSD and anxiety disorders that you've been talking about?
Yeah, so my main job is actually making sure all the pieces of the program are running, and it's a pretty big program at this point. We have over 60 people on our staff, and that includes social workers. It includes psychologists, it includes psychiatrists, it includes pain specialists, substance use specialists, and just making sure that all of those pieces are running. And basically, we set an individualized treatment program for each veteran. So the beginning of a veteran being involved with our program, they call us, they talk to one of our veteran coordinators, care coordinators, our VCCs we call them, and they'll go through a brief screen and then schedule them for an intake. And the intake happens over the phone where we're trying to get all the information about what's going on with this veteran in this moment. And based on that, we set up an individualized treatment plan. So it might be a post-traumatic stress disorder treatment plan where we're typically using therapy called prolonged exposure, which is really a gold standard treatment for PTSD. But in addition to that, we're adding other pieces into that. So if they're depressed as well, then we're adding some behavioral activation. We're adding some ways of getting connected with the world. We also have our case managers who are starting from the moment that we first meet a veteran with planning that what's going to happen after they leave us so that they can maintain their care. They can continue to grow. They can continue to improve and function even better. If they have substance abuse, then we're building that into their 2-week program. TBI is the same thing. One of the pieces that I'm really excited about right now is building in chronic pain management into our treatment program, because it's super common for our veterans to have comorbid mental health and pain. And we know that those veterans who are reporting higher levels of pain, who also have PTSD, are actually at the highest risk for suicide over time. And so being able to address pain at the same time as we're addressing PTSD may actually help us to reduce suicide. We also know, I've looked in our data from our program, that we are reducing suicidal ideation in the service members and veterans that come to us. I also should mention, I've spoken a lot about veterans. That's kind of my normal way of talking.
Yeah.
But we also work with active duty in the Emory Veterans Program, and we're seeing, I think it's about 14% at this point of our attendees in the program are active duty.
What about success stories? Because I would imagine those are the ones that make the room light up, knowing that the work that y'all do and how hard you work to get to those successes. Can you share any of those with us?
Yeah, so I can't share specifics because of privacy and stuff, but I will say every Friday we have a graduation. We had a graduation ceremony. We're doing it differently now, but every Friday we have a group of veterans and service members that are graduating, and they get to talk through what they see as their biggest accomplishments. And it's a very moving, very motivating experience. All of our providers say, people who have worked on like weekly therapy, which is typically the standard, who then come to be a provider in our 2-week program, they don't want to go back because it's so nice to be able to see people making such progress in just a 2-week period. We actually get to see them change their lives. They'll look different. They'll dress different. We've had some attendees who have named their children after us.
Oh, wow.
when a baby was born.
I can understand.
So that's pretty impressive. But yeah, we're changing lives. And we often have attendees say things like, I wouldn't be here today if it wasn't for the Emory Healthcare Veterans Program.
I mean, it's amazing, Dr. Rauch. It really is. You serve as the Director of Mental Health Research and Program Evaluation at the Atlanta VA Medical Center. What's the data telling us today, and how has the VA progressed in its diagnosis and treatment of those hidden wounds of war? I mean, going back to Vietnam, the global war on terror. I mean, there's plenty to choose from.
Yeah. So the VA is really the biggest research entity for post-traumatic stress disorder and looking at invisible wounds of war, traumatic brain injury. There's so much research going on. I can't even begin to talk about all of it today. But I will say that we've learned a lot about what works in the VA research, what works for treatment, what might not work so well, but also what veterans want. Is another big piece of what VA research is looking into, because we can have lots of treatments that work really well, but if veterans don't want it or they feel somehow not able to accept it, then that's not going to be useful. So there's a lot of really excellent research that's going on. My research on mechanisms, I've moved PTSD treatment into a primary care setting in several studies that we have going. Now we have a training program with 379 providers in primary care in the VA, so people don't have to wait to be in specialty mental health to treat their PTSD. They can just come in, talk to their primary care doc, and get started right away with PTSD treatment.
Wow. So now you joined the Warrior Alliance. there's a new partnership. In what ways does Emory Healthcare partner with the Warrior Alliance, and what value does it bring to veterans and their families?
Yeah, so our work with the Warrior Alliance really helps to, what's the word I'm looking for? Exponentially enhances.
Ooh, exponentially.
It really
That's
it
a big one.
enhances
That's a
our
lot, yeah.
outreach and really helps us to get out there and get more people aware of the Emory Healthcare Veterans Program. Barbara Rothbaum, my boss and the director of the program, often says that we're one of the best kept secrets, and we don't want to be. So we still have empty seats in our program many weeks. So we need more people coming, calling, getting in touch with us so that they can start their journey and actually get amazing treatment.
Wow. So let's help you with that right now, folks. If you're listening right now and you want to get involved or you need some help, which is okay to reach out and get help. We know you're a warrior, but that's part of it, is joining the team. Go to thewarrioralliance.org to sign up, and they'll help you get in touch. You can also check out emoryhealthcare.org /centers-programs/veterans program. Just dial it up and navigate on the website, emoryhealthcare.org. But really, if you go to thewarrioralliance.org, they'll help you figure out not just how to get a hold of Emory, but all kinds of resources and help that's available out there. I wanted to ask you about veteran suicide. You brought that up, and it's a big concern for all of us. It should be, 22 a day on average is the last numbers I heard. 8,000 a year since 9/11. Is that still the number? And do you think it's possible to get that number way down, hopefully to zero? And how are we going to do it?
So the number kind of goes up and down a little bit, but stays right around that same area. What I would say is we can get it down. We have lots of people who are focused on trying to get it down in many different ways. One of the most exciting ways that I'm interested in getting it down is really finding getting good treatments out to patients so that they can have their depression, their PTSD, their other mental health issues addressed, but also making sure that we're getting that outreach out there, because we know the veterans and service members that are at the highest risk are not connected to mental health care. They're not connected to any service organization, or they're kind of alone, isolated, and that's one of the really big risk factors for actually acting on suicide. So things like the Warrior Alliance, things like our veteran outreach coordinators, getting out there, letting people know that there are treatments that work, letting people know that they can be optimistic, and having options that are free to veterans and service members, like our Emory Healthcare Veterans Program, because Wounded Warrior Project's been generous in providing us the support for our program. People can come and get no cost to them care for their mental health and invisible wounds of war.
No cost. That's important.
Yeah, it's a good one.
You got to take down that pay barrier.
That's right.
That wall. Also, I know right now, somewhere out there, there's definitely a veteran or two or more who are listening who are experiencing some of these symptoms that you've shared of PTSD. Would you, or maybe somebody who just knows a veteran who's exhibiting those symptoms, would you talk directly to them and say, maybe what's the first aid? First of all, like what can you do right away in this hour about it? And then what advice would you give them going forward?
Yeah. Speaking to veterans and service members who are out there who may need mental health services, what I would say is treatment works, and reach out for help. You can reach out to lots of places. You can reach out to the Emory Healthcare Veterans Program and speak to one of our veteran care coordinators. The number that you can call directly is 888-514-5345. That again is 888-514-5345, and you'll speak with one of our veteran care coordinators. They'll do a brief screen with you. If we're not the right place for you to get help, then we'll also work to connect you to places that are a good fit for you.
Okay.
They'll schedule you for an intake, and then we'll work with you on what's going to be a good treatment plan.
But what if they're just having a moment right now and they just need to, before they make that call, what do you say to somebody who just needs immediate to calm down, and how do you talk to them?
How would I talk to them? I would say, let's sit down and spend a little time and talk through it.
Yeah.
There's also the Veterans Crisis Line, which is free for anyone if you're having any issues, actually, you can call the Veterans Crisis Line at 988.
Okay, yeah.
And then you hit 1 to get a veteran-specific coordinator. That's a VA and our tax dollars at work that pays for that.
So if you're having an emergency, maybe dial 988, and then if you want to go ahead and set up a treatment plan and get some consultation from the Emory Veteran Care Coordinator, call 888-514-5345, right?
Yep.
Oh, there's a lot of discussion and really debate recently about a controversial treatment option, and you can't turn on a podcast or the media or look at any kind of social media, definitely, without seeing this. So we wanted to ask you about it. What about this new MDMA-assisted therapy? Is that even a viable option?
Yeah, so there is a lot of controversy about that. I know the FDA recently said we need some more data and research on MDMA-assisted therapy for post-traumatic stress disorder. I would agree with that. I would also say, though, that at Emory, we're actually doing some of that research right now. We're looking at adding MDMA to our 2-week intensive program. So it's a slightly modified version, but it's a PTSD-focused 2-week program. And then we're adding MDMA to that program to really see if it makes the treatment work faster, maybe makes it work better for some people. And so we're actually part of that data collection process.
So it's sort of, from an outsider's perspective, though, how do we justify the fact that we're trying to help folks stay off of or get off of drugs, but then we're going to use MDMA-assisted therapy? And is it akin to sort of the THC treatment type of thing? Or how does that work? How do you justify that in your world?
Yeah, so first of all, I would say that what we are looking at and what I would suggest kind of longer term, it's not the daily use of MDMA. Typically, we would want to be looking at the minimum necessary dose of these types of chemicals, drugs, to see if they can augment. Like, for instance, in our program, we're looking at just a single dose of MDMA that's provided in combination with a therapy that we know is effective for post-traumatic stress disorder already, to see if it boosts it, if it enhances that effect, makes it work more quickly or better. I'm also doing some research with cannabis, specifically with some collaborators in Detroit at Wayne State University. We're about to start a smoked cannabis intervention trial, and we're just finishing up dronabinol, which is a synthetic THC or placebo study. And both of those are that same kind of idea, that we are adding a specific dose before specific sessions of therapy. It's not chronic smoking of cannabis, which we know is not helpful and tends to increase symptoms of depression and potentially interferes with post-traumatic stress disorder treatment. When we look at large databases in the VA, we can see that chronic smoking is a contraindication for treatment.
And bad for your lungs.
Bad in general for, I guess, you're trying to fight depression, and it doesn't really help with that, does it? So that's why it's kind of confusing. And I guess it's kind of like you got to look at MDMA because it's whatever's going to make veterans feel better. We got to look at it, right? But I also wonder, in your studies and in your research, how does religion play into all this? Is there any of that? Does that ever help a veteran to find religion?
Yeah.
Or lean on their faith if they already have it.
Right.
So in our program, we actually will work with people on individualized plans. And for some people who come in, they want to talk about their faith. That's an important piece of what their recovery plan would include. We also do help people to find connections to faith communities if that's something that they're interested in. It's really very individually based. For some people, that's a huge piece for them. For other people, it's not as much.
I can see that because it's a huge thing for me. It's so important, so I could totally relate to that.
It's a personal decision for everybody.
Certainly is.
Yeah, the whole thing, I guess. But really, the best decision is just to get in touch and start your treatment plan with the folks at Emory, right?
Well, let's talk about quickly, what makes you tick? Now, you've been married for 29 years. Your husband is an Army veteran, and your family, a lot of veterans in there. What keeps you busy when you're not working, which it sounds like you work a lot? I
have 2 boys who keep me busy as well. They're getting bigger, so we're about to be empty nesters, so that's kind of weird.
I'm there with you. Yeah, happened for us last year.
Yeah, but that's, so they've kept me busy quite a bit. I used to play soccer. I played soccer for 26 years.
Wow.
And then my knees aren't doing so well. So now I'm a runner, and I do a lot of running with, as long as I stay in a straight line.
Okay.
It's the side to side that my knees can't take. So.
Got it.
So I'm a runner now, and I love running 5Ks and 10Ks. Nothing longer than that.
Oh, my gosh, that's plenty.
And your husband's a veteran. What did he transition to in for next career after his
so
service?
he's a computer engineer. So he actually followed me around the country as a computer engineer, setting up networks at different universities that I was working in. One interesting piece of his history is that I went to graduate school in University of North Dakota, and he took a
my
job.
My brother-in-law graduated from there.
Oh, all right. So he took a job at Valley City State University and actually set up the first wireless laptop campus. He designed it, set it up way back in the 90s.
There you go. That's big time there. Well, thank you so much for taking the time. I think we hit so many valuable topics that are really, really pressing, especially in the veteran community. So thank you for your work. Thank you for everything you do. God bless you, and hope you'll come back to see us soon.
Thank you so much for having me.
Thank you, Dr. Rauch.